Thanks for being with us. I'm Scott Wickersham.
I'm Erica Bryant. Contact tracing is a critical piece of keeping COVID-19 under control.
Mecklenburg County has had problems with tracing, and that's why the director of the CDC is in Charlotte today. Well, today we're also seeing some issues with testing. Long lines here in Caldwell County and results that can take up to 10 days to come back, complicating things even more.
Channel 9 has team coverage of those issues and why tracing is so important. We begin with Joe Bruno and what the CDC director said today. Joe?
CDC Director Dr. Robert Redfield said if everybody just wore a mask, if they just put on a face covering, this virus would be driven into the ground within 6 weeks. Dr. Redfield was in Charlotte today to meet with Mecklenburg County leaders and discuss contact tracing. As I reported last week, Mecklenburg County has had some difficulty with this crucial part of the virus. One of the issues is the fact that there's a backlog of tests in the lab. By the time results come back, it's hard to notify people in this period of contagion. Dr. Redfield said North Carolina's trends are positive, and he called South Carolina's situation unique. He says millennials and Gen Z are driving a lot of the new cases. He's pleading for them to wear masks and social distance.
We are not defenseless against this virus. We actually have some of the most powerful weapons you could ask to have. And the most powerful weapon that we have that I know of is wearing face coverings when you're in public.
Well, last week, Dr. Mandy Cohen said she was concerned about our hospitalization rate here in Charlotte. Joe, the CDC director, said really it comes down to a local decision.
Yeah, so our hospitals right now are running at about 80% capacity, and really what Dr. Redfield was saying is it's up to Atrium and Novant if they want to sound the alarm at 85% or 90%. Really, it all comes down to what they're comfortable with. Mecklenburg County Health Director Gibby Harris is keeping a close eye on South Carolina's rising cases and their impact on Atrium and Novant. South Carolina is seeing significant increases and is a real concern right now to Mecklenburg County.
We do know that our hospital systems serve a region. They don't just serve Mecklenburg County. And so we do know that the individuals who are impacted by this in South Carolina may actually access service here. So we, again, just have to keep a close eye on what's happening and making sure that the hospitals have the capacity they need.
At this point, our hospitals have enough capacity and a field hospital is not needed. Dr. Robert Redfield also said that he is in favor of closing down bars or restaurants that transition into some sort of nightlife activity. That is something that the county is now taking a look at. It's what South Carolina and Orange County, North Carolina did last week. And coming up on Eyewitness News at 6, why Dr. Redfield says it's actually safer from a public health perspective to have kids in school than to keep them out of school this fall. Back to you.
Okay, Joe, thank you. Again, that contact tracing is so very important in stopping the spread of coronavirus. We want to take a moment to explain exactly how it works and to give you a better understanding of the contact tracing. Well, first, a contact tracer is essentially taking on the role of a detective. Just like a detective trying to solve a crime, contact tracers try to track down those who might have come in contact with a person who tested positive. Well, once they find those people, they urge them to monitor their symptoms or to voluntarily self-quarantine. But just like a detective, it can't be an easy job. Many contact tracers say they're running into a number of issues. Here in Mecklenburg County, they are being ignored, they say. People are hanging up on them or getting little or unhelpful information, like only the first name, no phone number, no address of the people with numbers listed. The county was only able to get in touch with about 85% of them. Another issue, contact tracers cannot make you self-isolate.